come on in everybody. Today we're going to be doing collaborative learning. So what I want you guys to do is we're going to be talking about purposeful rounding today. And as you know, we do purposeful rounding every day. And what we do is with purposeful rounding is we try to react to the patient proactively instead of reactively. It cuts down with our call outs and stuff like that. So we really, it's really useful for us and the patients. But we're going to come up with some new ideas today. And so our objectives today is, one, we want to demonstrate purposeful rounding to make sure that we're doing it correctly. And so number two, we're going to identify, collaboratively discuss some barriers to purposeful rounding. And then number three, we're going to collaboratively identify some techniques that we could use to maybe increase our patient satisfaction around purposeful rounding. So Wanda, you're going to be the patient today. So if you don't mind getting to bed. Kelly, you're going to be the nurse that's going to be rounding. And Laboria, I'm going to give you a purposeful rounding observation sheet. Okay. And you're going to be watching Kelly do her purposeful rounding and telling her what she does good, what she can improve on, so we can make sure that it's done correctly, okay?
Okay.
Okay. Everybody ready? If you want to, Kelly, you can go ahead and start.
Good evening, Miss Newsom. My name's Kelly. I'm going to be your nurse tonight.
Hello, Kelly. How are you today?
I'm doing well. How are you?
I'm doing great, thank you.
Did you have a good day?
Yeah, so far.
All right. Well, I'm just coming around to say hello, and I'll be back in about 30 minutes to do your assessment. And then I'll bring in all of your nighttime meds, and then just kind of give you an idea of how the night will look. About every hour, myself and the tech will be end around on you. We'll just see if you need to use the bathroom, if you have any pain at all. Make sure all your plugs are plugged in, and then if you can reach your phone and your call light, all right?
Okay.
If you need anything, your call lights are right here on the side of the bed.
Okay.
I'll put your bedside table over very close so you can reach your belongings.
Okay.
And then, is there anything I can get for you right now?
No, I'm good, thank
Are you having any pain at all?
No, I'm okay, thank you.
Okay, well, I'll be back in about 30 minutes.
Okay. Oh, wait a minute. I think
Yes.
I do want my table a little bit closer
Okay.
to me, please.
Just move it up for you. Can you reach this?
Yes.
All
Thank
right.
you.
Well, I'll see you in about 30 minutes.
Okay. Yeah, and wait a minute, one more thing. Can you just push this across me a little bit?
Sure.
Please?
There you go.
All right, thank you.
All right.
Okay. Laboria, how'd she do?
She did wonderful.
Good.
She acknowledged herself. A little more eye contact.
Yeah.
But you did the 5 P's: pain, position, plugs, and potty. You did good. Did more eye contact.
Okay.
But you did wonderful.
Okay. So the next thing that we want to talk about today is the barriers. So maybe you can think about, Wanda, from the patient's perspective, what barriers could there be from rounding? And Kelly's going to think about the nursing perspective, and Laboria, you can think about the tech perspective. So Wanda, you want to start? What can you think of from the patient perspective that might be a barrier?
Pain. Then I don't want them to be in here talking while I don't have some pain medicine and trying to relax.
Mm-hmm.
So, I think that, I don't think they should be in here, not necessarily say that they shouldn't be in here, but I don't want to hear them discussing me while I don't have some pain medicine and I'm trying to go to sleep.
Mm-hmm. Okay. Can y'all agree with that? Like seeing patients that are
Yes.
having pain?
Yeah.
Okay.
Yeah, especially when you're trying to do vitamins, they ain't pain, they don't want to be bothered.
Mm-hmm. Okay. Kelly?
Probably from the nursing side, if they're away for procedures or doctors are in here doing procedures at the bedside, it's hard to come in and round.
Mm-hmm. I think, I know I've been in that circumstance. Have y'all seen that too as
Yeah,
well?
when we come in, doctor's doing a tap or something with a patient, can you come back?
Yeah.
Mm-hmm.
Well, from a tech side of rest, they don't want to be bothered. Hey, can you give us a couple hours? We like to sleep, before you guys come back. So
Okay.
that's their main thing.
Okay. So sleep. If the patient's
Yes,
resting
they
and
can.
sleeping, they don't want to be bothered. And,
Mm-hmm.
okay. So the last thing we want to do is thinking about patient satisfaction and rounding. What are some things that we could improve our patient satisfaction scores? For example, response to call outs, that sort of thing, making sure that we're rounding timely. What are some ideas that you guys have that we could incorporate into our rounding that we could increase our patient satisfaction scores? So you want to list maybe 1 or 2, 3 techniques that we could incorporate what about from a patient's perspective,
When
Wanda?
they finish doing their rounds or whatever they do on this computer, they can turn that light off and turn it sideways or turn the computer out so the light won't be flashing in my face.
Mm-hmm.
So in bathroom lights, make sure if that's what I want, to have the lights and stuff off
Okay.
and the computer out of my face.
Okay. All right. What else can you think of? Anything else that might bother the patient if you're coming in to do your rounding? Can anybody else think of anything?
Probably if we left the door open, they're trying to sleep, closing the
Yeah,
door.
Mm-hmm.
So you say environment.
Yeah,
Yeah, like environmental issues.
making sure they can
Just
reach
making
on
sure-
the wall.
Yeah.
Making sure my the potty chair is in reach where I can get to it.
Temperature's comfortable.
Yeah.
Okay. What about from the nursing perspective? What do you think we could do differently that might help? Or
I think probably both us and the techs could write our phone numbers on the board so that
Oh,
way
yeah.
the patient can contact whoever they want directly instead of having to go through the secretary.
Okay, that's a great idea. Okay, so Laboria, do you think that would work from the text perspective? Do you guys all carry phones?
Right.
That'd be something that would be helpful.
They call us looking for nurses too.
Okay. You think that we'd have to instruct them?
Yeah.
Education.
Education wise.
Okay.
And then when they round to do their ice, everything at one time instead of back and forth. When they come in to do my body sign, bring the ice with them and instead of
word.
Yeah, from the tech side of it, cluster the
Yeah.
care.
Some patients like to be frequently round down.
Mhm.
Round down, so.
So we can say, I think I hear you saying cluster your care,
Mm-hmm.
and then you're saying,
Some like to be frequently round down.
Okay, so we can actually add 4 ideas. That's great. So cluster care for one, and then you're saying that we need to make sure that. Let me make sure you're saying that I understand what you're saying, but you want to make sure that we ask the patient how frequently they want
They want to be
rounded.
rounded, right?
Okay.
Their preferences.
Okay, so get their preferences on how often. Okay, great. I think y'all came up with some great ideas. And so what I'm going to do is I'm going to be, rolling out your ideas. Maybe we can talk to Partnership Council about the ideas that we have. And we can monitor the patient satisfaction scores, and I will let you guys know what those are and kind of see if we, collaboratively with the ideas that we came up with can maybe increase our scores. The other thing I'm going to have y'all do is I'm going to send you guys out a little evaluation form in your email, just if you'd like to fill it out. Maybe if you think this was helpful, just let us know. Let me know if this is something that you think could be used, in the future on other things.
Okay.
Okay?
All right.
Okay, thank you guys for your time.
Yeah, you're welcome.